Common causes of cancer death for women in the United States. But the American Cancer Society says the cervical cancer death rate has now dropped by more than half since the 1970s, thanks to prevention and screening.
And today, the organization is announcing new updates to screening guidelines for this disease. In today's Health Minute, Mandy Gaither goes over the changes that every woman should know.
First, the bad news. In the U.S. this year alone, it's estimated that more than 13,000 new cases of invasive cervical cancer will be diagnosed, and more than 4,000 women will die from the disease. But the good news is those numbers have dropped dramatically over the years, but not everywhere.
There's wide disparities in this country amongst cervical cancer rates, and particularly in rural areas, and particularly in the rural South, we continue to see many women presenting to physicians with advanced cervical cancer.
That's why the American Cancer Society is releasing these new guidelines today for cervical cancer screening aimed at reducing deaths from the disease. While the traditional method of a pap smear every 5 years remains the preferred screening method, there's now an acceptable option for women at average risk who don't want a pelvic exam. Taking one of 2 FDA-approved self-collection tests is now recommended every 3 years, as long as the results are negative through age 65.
We know, particularly if it's difficult in making an appointment, some women may have privacy concerns initially. So we do think having the ability to have FDA-approved tests every 3 years for self-collection is a wonderful other option.
For women older than age 65 who have had adequate prior screening and not otherwise at high risk, screening is no longer recommended by the organization.
If you're at higher risk because you have HIV disease, you have immunosuppression, your screening should be done with the work through a physician.
For Health Minute, I'm Mandy Gaither.
The FDA-approved tests that detect cancer-causing types of the virus or HPV in the cervix using a swab or brush to collect the sample.
And while the patient does it on their own, the FDA says it must be done in a healthcare setting, such as primary care offices, urgent care, pharmacies, and mobile clinics. And that's